Hi, I am Dr. Julie Brown. I am a trained concussion doctor. I am honored to be back with the CCA. They've asked me to speak at the Sports Symposium on concussion. The first hour is going to include mandatory history taking and physical exam. In there, we are going to talk about the mechanism of action for concussion, the etiology of mild traumatic and major traumatic brain injuries. We're going to talk about the definitions with the recent consensus. We're then going to talk about assessment on the field. We're going to talk about assessment of on the field and then in the locker room. We're also going to talk about what happens in those first 24 hours and what you do in the office within first 24 hours of a concussion. And there we'll talk about physical and cognitive signs and symptoms. We're going to talk about the cranial nerves. We're going to talk about the vestibulo-ocular reflex, balance, and the vestibulo-ocular motor screening. The second half is going to cover rehab protocols, and in that we are going to talk about vestibular therapy, chiropractic adjustments, the visual ocular motor therapies, movement and exercise. Then we're going to talk about return to play or return to learn protocols. And then we're going to talk about the difference between managing a concussion on the sideline versus in the office. So I look forward to seeing you there.